Hi, my name is Tom Willman from Apex Orthopedic Rehabilitation in Providence, New Jersey. Today we're going to talk about, do we brace or not after we're starting to experience back pain or recurrence or the first episode. At the end of this video we're going to talk about a simple strategy about how to slowly get off the use of the brace and other things you consider while using the brace and slowly getting over that episode of pain. All right, so stay tuned at the end for that. So you've had this first episode, you've just started the episode, you picked out a brace. I generally recommend the first time it's just like a soft brace that has it's a little bit pliable, a little bit more give when we're doing it. I want it during active times. I want it during times when you're doing things, so you're reminded about that. But what I don't want it to, I prefer not to have you do it, is when you're sitting. I actually like using like a regular lumbar support, which we talked about in our other videos, that kind of goes and sits right about here in your lower back when you're sitting in a car or driving. And also when you're sleeping too, I prefer not to have the brace on. Try and look at like a sleep pillow or positioning in the bed. That's the times I want you out of the brace and all that. Because the brace does create a little bit of stiffness depending on how large it is. And we want to have a little bit of motion in there, but not too much. Okay, so being very active, you're going shopping, you're moving a lot, you're doing activities around the kitchen, you're keeping active. That's the times where I like to have the brace, hopefully a little support and a little reminder of what you have going on, especially as you start coming out of the injury. Sometimes we forget we're having pain or we're having an issue, and we start doing things we're not really supposed to. It's probably a little bit too early to try. So those are the times I like the brace for a little bit, just to get past those early stages. So the function of all these type of braces are to do a few things, or we think they do a few things. One, they restrict movement. They protect, just like an injury to, let's say, a fracture or a tendon injury to your finger. The application of a splint is to allow the area to heal, to prevent movement that disrupts the scar tissue. Almost like, I give this analogy a lot in here, like a cut on your knuckle. Every time you bend that cut, it kind of opens up the cut and delays the healing somewhat. So we want a little protection for that area. The area that we're talking about is the lower back area during this episode of back pain. It will restrict movement depending on what kind of brace we're talking, a soft, semi-rigid, or rigid brace like we talked about. Also, it gives you a little sense of, like, if you're moving into a position that might be not good for you, you'll actually feel the brace kind of bind and give you a little sense of, ooh, we're getting into a dangerous position, or maybe we're moving too far forward. And I call that position sense, okay? Little thing that kind of aids the body in the early stages, especially when we're having a lot of spasm and difficulty. And those are some of the things that the brace actually serves to function as. So right here we have a brace that's a semi-rigid brace, Velcro. One example, it's not the fully rigid brace or the soft one, but it's one of the options that you can consider when choosing a brace after a bout of lower back pain or in the middle of one. So right now, let's just assume we're on day 3. You had the episode, whatever started. Sometimes it's just sitting too long. Maybe it's a new workout that you tried. On day 3, things are typically getting a little bit better. The back naturally heals in a lot of situations just by the passage of time. Even if you don't wear a brace, you don't see a therapist, you don't take any Advil, nothing. Things do get better. And they call the natural history of back pain is a lot of things get better within 2 or 3 months. We're just trying to make sure the best environment for it to heal. So what I like to do in the early stages is to slowly wean ourselves off the brace. If you're wearing it for a full 8-hour day, let's say you work at Target or something like that, maybe we start by, the first 4 hours we have it on and the last 4 hours we have it off. Or maybe with the idea that maybe we're going to get tired at the end of the day, maybe we start without the brace and then add it in maybe 4 hours later and then, finish out the day with it. The idea is that we want to slowly get away from that. We want to also realize that it's a temporary solution. I don't like to see people, and I don't think there's great evidence that prevention of wearing a brace prevents the back pain. And I think in some cases when we wear a back brace, we feel like we're Superman, where there's no chance of us injuring ourselves when there is a chance. So we want to be careful that we don't mask it by just locking down our spine, compressing it, and act like a stabilizer. It does in cases too, depending on the type of brace and depending on how much you lock it down, it changes your movement patterns a little bit. You just kind of get out of a chair a little differently. You move a little differently. So I do want you to eventually move a little bit so you don't get stiff. And that can contribute to the episode, I think, sometimes taking a little longer than it should. So consider some of those options. So day 3 is kind of a time, 3 to 5 days. We probably have enough healing, that we can start maybe slowly seeing if we can get off the brace. Worst come to worst, we go back to it, okay? But it does affect the way we move. And they've shown in some studies that actually long-term use of bracing for certain things changes the way you move. And we want you to kind of keep that, especially when we teach people here like back school, we teach them how we want to move certain ways to decrease the chance of injury, especially if you've had a previous episode of pain. So it's harder to do that when you do have a brace on, okay? And it's harder to feel where your back is in space. So consider that. Day 3 to 5 is our magical period where we start to try and wean off. And you can do it gradually, whatever seems to work for you as far as the timing of it and activities, okay? Really flares up, you can go back to it. But at a certain point, you're probably missing something. Probably if you're just back bracing, you're not doing exercise or maybe anti-inflammatories, or maybe there's something that's triggering your back pain. Maybe the brace is not the solution. Maybe there's something else. I like to give the analogy, it's like a lot of times, we like to target one particular intervention was the solution to our problem. Sometimes it's time, like we talked about. The back naturally heals within 2 or 3 months, most people. Maybe it was that exercise a physical therapist gave you. Maybe it was the Advil. It's a cake. It's got lots of ingredients in it. So you may be having a missing ingredient of just doing the back brace and walking away from it. So think about that. Some people use it. Some people don't like to use braces at all. If it really feels, it should feel good and it should feel steady. But realize it's a temporary transitional thing that we want to eventually get back to understanding how our back moves, looking at good mechanics, how we move, our sitting posture, and really look at it as not just one factor that's going to cure us as far as our back pain. Also consider when we're wearing those braces, that's great, but one thing I will tell you is you want to really get out of one position too long, whether it be standing, sitting, especially in the brace where you're kind of sometimes in a more of an unnatural position because you're getting sucked in with that brace, is not to sit more than 20 minutes, and in some severe cases not more than 10 minutes, and trying to move and walk as much as you can tolerate without it flaring you up, without really having a significant setback. That's the key to really, as far as prevention, and slowly getting moving and not completely shutting down. When we shut down, things get worse. Our body wants to move a little bit throughout the time. Listen, I hope this helps you out. Subscribe to our channel if you want to hear about new things. Hit that like button. And don't forget, put on notifications so you hear about our next video when it's posted, okay? Have a great day. Here's to you moving better.